Ladies and gentlemen, today we are honored to have with us a highly skilled cardiologist who is known not only for his deep expertise in heart health and navigating the NHS, but also for his nonsense, straight to the point approach. He believes in cutting through the noise and tackling challenges heads on and finding solutions on the go. Please welcome the dynamic and accomplished Dr. El-Gendi. Welcome, Dr. El-Gendi. Thanks for giving us the pleasure to have this time with you today, which I'm sure that we're going to have lots of fun today and use of information for overseas doctors to understand how to navigate the system. Can I start by asking you, what are the main challenges that you see overseas doctors face when they first come to the UK?
So first of all, thank you for inviting me to this podcast. There is some challenges which face overseas doctors to move to the UK, as there is challenges for any physician or doctor to move to work anywhere in the world other than his own environment. I think the main challenge would be not being fully prepared for the job ahead. Sometimes very underprepared, sometimes overprepared to the extent you become very stressed and you can't perform. The other challenges would be some logistics in terms of the job you applied for. Sometimes it's much higher than what you should be or much lower. Again, not full understanding of the system, but more important, and I think this should be the core of the interview today, is not really using all the materials in hand which are there to help you. So I think that is the most important thing, that many people do not really understand that the system is around making them succeed. And there is lots of tools and ways within the system to make them go through these challenges and be victorious.
Amazing. Thank you for highlighting these points and going into depth about this. From what you said just now, would you think that these struggles for overseas doctors apply to only newcomers, or does it also affect other doctors who's been here for maybe for months or years?
Well, it affects us as well. So it affects everyone in every single day of your life in your practice. But it clearly will affect more doctors moving from a completely different environment to work for the first time in the UK.
Thank you. Thank you for spotting the light on this fact. I find it myself as well. When I moved into the UK, I had lots of struggles, and I'm still having struggles, but they are different type of struggles. They're more challenging, and it will continue to happen. We have to evolve ourselves every single day in our journey in the NHS. But could you share with us some of the key strategies or tips that have helped overseas doctors successfully integrate to the NHS?
So basically, I'd like to not necessarily call it a strategy, but I say ways of going through the NHS for the first time and be successful. So the first thing you should follow is to read about the NHS, understand what is it all about. It's all patient-centered approach and not for financial profit. And then to understand the structure of the NHS, how it works. Either you're going to work as a GP or you're going to work in a hospital environment, and what kind of level you're going to go into. And then your specific first placement, you need to read more about it. It's more about the local hospital you're going to be your first appointment. What are the main challenges? What is the situation in terms of services? And then obviously you need to read about your role and how you can perform. And finally, you need also to be prepared to engage with individuals who have been longer in the trust before you, and to learn and to be open for change. And I think the key is to be flexible. And I'm sure, as you have found in your experience, people who are flexible and happy to change are the most successful individuals.
Thank you for highlighting all these very, very important points. One thing which you've highlighted is be flexible and interact with other colleagues. How can you see overseas doctors with language barrier they have and culture barrier be able to interact with local colleagues in the department?
Not necessarily local colleagues, but also, as you understand, 1 in 3 or 1 in 4 in the NHS now are overseas graduates. So really to interact with colleagues who have been in the system, either they are local or foreigners, You have, as I mentioned before, you have a degree of flexibility, ability to change to the better, ability to learn. And I think is a key challenge, apart from the language, which is a big issue, is the cultural difference. Passing your language just is one thing, but understanding the local language and dialect is another thing. So if you're appointed here in London, it's very different than being appointed in, say, for example, in Glasgow or being appointed in Edinburgh. So this is obviously a language issue, but more important is a cultural issue. So many of our overseas colleagues, when they come here, they only mix with people from the same background, don't mix with. So I think it all starts from the beginning, really. You come to work in England, you need to understand the other nationalities, particularly British people. You need to watch British TV. You don't necessarily have to watch your own TV, for example. And you mix with the local in your own environment. That when you take it with you then to your workplace, mix with different people with open mind, but also don't forget you bring with yourself your own strengths, and I'm sure people will be also ready to learn from you, from your own culture, from your own practices, back in your own home country.
Thank you very much for elaborating on this. Which takes me to another area on the same pace. So I personally struggled when I came in as well with understanding the local dialect, because, as you said, differs from south of England to north of England. And it's always intriguing to see how much variation of way people pronounce English in this country. But one of the ways I managed to overcome this by listening carefully to other doctors while they're speaking, and also asking them to repeat what they just said if they repeated or said it in a way that I couldn't understand. And this is another tip, which, exactly. I find it helpful. I'm glad you find it helpful as well. Do you find it helpful as well?
Exactly. So I understand the problem is when you come from overseas, you think it's an insult to your ability if you ask the patient to repeat the question because you didn't understand it. But reality is English language is spoken by more than 50% of the children all over the world, and they understand there is different accents. And I remember when I came as a medical student in training, I saw my consultant who was English speaking to a patient from Scotland, ask him to repeat 3 times because we didn't understand. Patients don't realize or take it as an insult or that you are less able to. But to be honest, sometimes you look at it as you are really caring. You want to understand everything they say. You don't want to miss anything. And they appreciate that most of the time.
Yeah, I mean, I'm glad you also agree on what I've just mentioned, elaborated on this. So thank you so much. And one also aspect I also would like to point as well for overseas doctors is, no matter how you are fitting in the system, there will always be a struggle, especially with language. And even till now, some of the dialects I don't understand and I have to ask them to repeat. But also there should be a smart way of asking them to repeat the question. So I think it's good to say, I couldn't understand what you said, or could you please repeat again so I could help you more with your query or with your question. Something along these lines. We have to develop some skills along the way that when we ask them to repeat, it doesn't sound that we don't understand English. It's just because there's different in dialects, and they may not be aware of this because they used to speak in this dialect all their life, and they're not going to change it just because they saw an overseas doctor in front of them. But I think what we have to do is adapt and understand and just make them repeat the question again, but find a smart way of asking them to repeat the question. No, thank you. I think this was a very, very healthy point, because I think this is a main struggle for everyone who comes to the UK. Which takes me to another point, which you mentioned earlier, about collaborating and communicating with local doctors, regardless if they are local or are also overseas doctors. What do you think the role of mentorship plays in helping overseas doctors thrive in the NHS? And how can they find a suitable mentor?
So I think mentorship is not only for overseas doctors, it's for everyone, and for all new consultants, we usually mentor them anyway. But for overseas doctors in particular, as I explained before, they need to understand there is loads of mechanisms within the system to make them succeed. And one of it is mentorship. So the mentor role is to gently and swiftly try to get you in the system. They need to meet their mentor. They need to before they meet their mentor, decide the points which they think it's their weakness and their strengths. So when I meet someone I'm going to mentor, so I ask them first to talk about themselves. We try to be informal as much as we can first, and then tell me what his strengths, what his weakness, where he think he needs improvement, and then we can work on that. So for example, if you think your weakness is the language, as you mentioned, we can give him some tips. If he thinks that his weakness is that there is some poor absorption of the very changing IT system which we use in the UK, and in some overseas places they do some things a bit more different or less advanced, then we can help with that as well. If they're saying the problem is communication with colleagues, we can help, we can guide. So mentorship is there, and if the trust does not offer you a mentor, you should really ask for one. But I think most of trusts now are in the understanding that this is their obligation.
I'm glad you pointed out the importance of mentorship here, and how doctors should ask for it if it wasn't offered. The thing which I have to also say here, although maybe in your trust you think or you believe it's an obligation, some other trusts, they don't offer this mentorship. For example, I've been in contact with one of other colleagues in the past few weeks talking about mentorship in the NHS. And the fact is, and reality is, there are no enough time for doctors who are already experienced in the system to have time to mentor other doctors. So I'm glad that your hospital is doing some mentorship and really acknowledging this important support system for overseas doctors. But I believe...
Yeah, so I don't believe, so mentorship could take different names. So it's not necessarily, when I said obligation, it's not formal, but there is some sort of mentorship within the system anywhere. I cannot believe a trust can get away without this system around. So you don't have to call him mentor. So for example, you are a middle grade doctor or a specialty doctor, you will have a supervisor who need to sign you off. That could be your mentor. Again, if you are a staff grade, there is a consultant who is responsible for the staff grades in the trust, and you can go to him. If you are a foundation doctor, you have educational supervisor and you have a clinical supervisor, and the same applies to specialty registrars. So if you are a consultant and that's your first appointment and there is no mentorship in the hospital, then there is a lead consultant you can go to and you can ask him for the help and some sort of form of assistance, really. So it does not have to have the title mentor where the trust is formally not really obliged to give you, but within the system, there is a way you can find someone who can help.
I'm glad you clarified this point. You mentioned also something important just now with when it's a consultant joining, not a staff grade or FY1 or junior doctor joining, you have the lead. But do you believe that is it easy for overseas doctors, or any doctor really, on a consultant level to ask for mentorship? Is it something easy or is it something difficult? Do you think it's something that is habit that anyone?
No, it's not easy. And to be honest with you, the system for overseas doctors is more tough on doctors who are joined at a senior level. Because the more senior you are, the less able to be flexible and to learn different strategies and different attitude. But also, the expectation from you are a bit higher. But there is ways around things. And I would say the problem starts when you're applying for your jobs. I mean, you had been shortlisted, you had an interview, you had a feel about people you're applying to work with. And if they are, I don't think you should be going for a job where you feel that you will not even find someone to guide you and mentor you. And these things become apparent during the appointment process.
And why do you think it's difficult for overseas doctors to ask for mentorship?
I think it goes back to the cultures and the values. So many of us who trained or graduated from overseas believe a doctor, it's a deficiency to ask for help, it's a deficiency to say, I don't know, and it's a deficiency to say, training in this or that. I mean, and this is where conflict
actually see excelling by the
understanding that the system in the UK here is not to make heroes. And there is no such thing as a genius guy of radiology or whatever, but there is some sort of efficiency, and it's a teamwork. It's not individual.
So how could you give them an insight on actually how to go to the gym and do something useful for them and for their health?
Well, as a cardiologist, it's not in my interest for anyone to go to the gym because not going to the gym gives me more customers, isn't it? No, I think it's not only about going. It's as I'm trying to say, it's about enjoying. If you don't enjoy going to do some sort of sports, it doesn't have to be going to the gym. Even walking around your house with your wife. I mean, then you're not going to be regular on it. I think you need to be very clear when you come here, if you have a family, to give time for your family, because a happy family will make a happy doctor. That's the first thing I ask my juniors, actually, if their family is happy or not. If they are not happy, you're not going to succeed because your life will be misery. And finding the time have never been a problem, to be honest. We all, and this is a stage of life when you realize that we all think we are in a race, and who arrive earlier. So if I get my training number before the guy who came with me from overseas, then I'm successful. If I don't, I fail.
Yeah.
That's not true. It's not a race, it's a journey.
Right. Yeah, I totally can relate to that. But from your personal experience with, I know you personally as well. You've had a journey going to the gym. Could you share with us, how did you manage to make a habit or routine to go to the gym to encourage other doctors? Because some doctors will say, I will try and go, I will try and enjoy it, but they actually never do anything. So how did you manage to go to the gym every single week on a specific time in the week?
I think by realizing, so let's hope it continues first, but let me say,
I'm sure it will because
let's just agree that everything to start with is very difficult. Say if it is like 7 in the morning or 6 in the morning and it's rainy outside, muddy, and it's much better to stay in bed. But you need to realize the first few weeks will be like torture, really, to move out and go. But you need to realize what this is embedded in your system. If you don't do it, you will feel very unhappy, and it becomes your joy of the week. It's not only, you're not doing it only to be more healthy or to but it's more kind of physical, but it's important for your mental health. Mental health exercise and regular exercise, depending on your age and your ability, is very important, and it makes you feel more positive. But also you mix with other people, you realize life is not about only the NHS, I'm afraid. Life is about people. People are people from different backgrounds, different professions, and it just open up. And there is a gym in some hospitals. If not, there is a gym around the hospitals. There is a massive discount for NHS doctors. I think you pay millions compared to other professions. Massive discount with, I don't want to say names, but I mean with many gyms as well. So everything is there. Just do it.
Yeah, amazing. And no, thanks for sharing your experience, and I'm sure it's going to continue. Because I think you shared with me how you did it. You actually told me that you have to script a time to go to the gym in your diary. It has to be this gym time that no one can come near it. It's like you're doing an NHS job because you have a passion for it. You wanted to make some changes, and I think it is the right thing to do. So again, advice for overseas doctors and any doctor who's watching this program, you have to script your success in NHS, but you also have to script your physical wellness and mental wellness by going to the gym or any other form of sports or any activities that you like to do. But I think going to the gym is something that we all enjoy. I personally enjoy going to the gym. And as you mentioned, you have to script a specific time. And even when I was approaching you to do this podcast and I mentioned the day you go there, you said, no, I've got the gym session this time, I can't do it. So I really respect this, and I think everyone should do this. Respect and really craft the time to go to the gym, or time to invest in yourself and your own mental health.
Agree.
Yeah, perfect. Excellent. So you kindly share with us lots of experiences and lots of good tips and tricks on how to navigate the system and how to settle in the system. And you kindly said you're going to share with us some of the courses that you thought was helpful and one of the books as well. So please don't forget to send them to me after this meeting. Yeah. Now, just going to something different now, which is about you. Well, it's good to know more about you as well, although I know you for many years, but sometimes. So just want to ask, why did you decide to become a doctor firsthand, and why did you go to cardiology especially?
So becoming a doctor, as you are aware, was not necessarily what I wanted. I wanted many things before. Ended up being a medic. As you know, it's all about your grades and your family expectation. Most of my family are doctors anyway. And so when I wanted to, but they were very clever in trying to convince me to go to medicine. They said, oh, you want to be a pilot? You can still be a pilot with medical background. And then you can be this, you can be that. Then I'm there.
Sure.
In terms of cardiology in particular, what I like about cardiology, and I'm sure as a radiologist, you share the same thing. We have a medical part of it, so you can work your brain a bit. You have a medical part of it, you have an imaging part of it, and you have an interventional or surgical part of it when you are implanting pacemakers or devices or doing an intervention. So it got this three, and even till that stage, you always go to work a bit with a buzz that you are solving a difficulty or dealing with a difficult case. It's not just a routine work. And your job plan is very different thing modalities. So you can have clinics, you can have ward rounds, you can have gas lab sessions. So it's all about doing something you enjoy. But more important thing about medicine, and I think we are blessed to be medics, is that you can make patients, or at least try to make patients better. And the feelings that you are helping someone or making a change for the positive, or trying, let's not say help, but try to make positive change in someone's life, that's where the buzz of happiness comes from. I think seeing the relief in your patient's eyes or their families is a blessing we have. And I'm very honest.
Amazing. Thanks for sharing this experience. Now, with every day at work, we build some wisdom and some way of doing things. Do you have any mantra or like a catchphrase that you use in your work, especially if you are facing difficult situation, if you are becoming stressful or frustrated from anything, or a difficult situation generally?
So what I usually say to everyone around me, because unfortunately as a consultant, everyone look at you to help with difficult situation, and you have to appear very calm from the outside. So inside, you know what it is. So I don't get stressed very quickly, but I always say to myself and to others, it's all going to be fine. At the end, it's all going to be fine. And when things are really over the top, I just say it's coffee time, because I'm a coffee addict with a lot of advantage for coffee, and I'm sure you are. And from the cardiology perspective, but this is my addiction. So coffee time,
My coffee.
Exactly. So you just disconnect completely with any problems, and just go and invite your team or your junior colleagues for some sort of nice coffee.
Amazing. So, what's a memorable city you've been to?
Sorry?
A memorable city that you've been to?
This is a very good question, and it's an interesting question. I've been to, actually, travel is my passion. I just came from somewhere very far. But actually, it's somewhere, I don't necessarily have to say the name of the country, but somewhere in Africa, where I went with all my team, including nurses, technician, for a charity program for about...
Wow.
We went for about a week. We did loads of procedures.
Amazing.
It was a charity completely. They took their annual leaves and used it for it. And we did loads of procedures in a place in Africa. And in fact, the happiness we went back with as a team from the difference to the life of people there was amazing. And it's interesting, this was more than 13, 14 years ago. Till now, some of my sociologists say that changes their life. They realize how we are very fortunate and blessed to be living in here. Or even, for all, no matter how we complain every single day about finance, about this, about that, how we are very fortunate.
And weather.
Exactly. And how medicine is, or being part of medicine, either you are a doctor or a nurse, or a physiologist, is actually a blessing as well, because you can make a huge difference to people.
It's amazing that you've got this amazing memory in this city that you've mentioned with your whole team. And it highlights something that I wasn't expecting to go into, which is charity and doing charity work. It is so pleasure that we could have this ability to do charity for other people and other people and countries who are in need and in demand for such, services that we provide. I must admit myself, as an overseas doctor back home, we did a lot of charity, but it was a different way. It was the way of giving money or giving support to certain people or certain charity. But here, you've learned a different way of doing charity and giving back to the community, which is actually doing it yourself, giving some of your time to help someone in need, a patient in need, or someone who actually would benefit from your time. Even saying kind words to the homeless people in the street is an act of charity. And it's something that's encouraged in all religions. And in the UK here, it's actually practiced on every single day. You see it every single day, which is amazing, really. So when we talked about the cities, is there any, you've got lots of memory in that city. What was the city that you visited? Because you said you travel a lot and you just come from somewhere far. What's the city that you've been to and you said, wow, this is an amazing place and I would love to come here again? And it would be good to tell people who are listening to this podcast about the city that you've seen, what was amazing about it and why they should go there. We're not doing an advert, it's just to give them a bit of insight if they want to go somewhere, because you've been and you could give them an insight of the best place you've been to.
So basically, I'm slightly biased, but as I say, I've been all over the world. In particular, going to the very far east and going to Tokyo, for example. I enjoyed Japan a lot.
Wow.
As advances, the food, everything there was fascinating for me. But to be honest, a place I'd like to be, and I say it again, it's not an advert. I like Hurghada. Hurghada in Egypt. It's on the Red Sea. I'm very interested in diving and in snorkeling and in swimming. But Hurghada, in my opinion, is like heaven for me. Even though I've been to many seaside places, but Hurghada in particular fascinate me, and it's very cheap as well to go. So it's
wow. Well, I didn't know that you got a passion for diving and snorkeling. It's amazing. I didn't know this. I always wanted to do diving, but never get a chance. But maybe I will have to start this somewhere.
See cardiologist first to make sure you don't have beef.
Yeah. I will come and see you. Don't worry. Dr. Gendi, thank you so much for this. Oh, thank you. That's a very generous offer. Dr. Gendi, it's been a pleasure having you today. And I've learned tons of information from you. Thank you. I've learned tons of information from you. And I'm glad that you have managed to share all these expertise from your days and years practicing in the NHS with our listener. And I'm sure they'll have tons of information once they go back to the comment box or description box where they find the resources that you're going to share with us today. Thanks again for your time. And we definitely not be the last. This is the first one. It's never going to be the last. I'm sure I'm sure there's going to be lots of stuff we could talk about in the future. So thank you. Looking forward for the second episode with you very soon. Have a great day.
Thank you. Take care. Bye-bye.
Thank you.